Let's talk about art therapy, art therapists, what they do, and the American Art Therapy Association. And I have the perfect person to talk about this with. Dr. Girija Kaimal. She is an associate professor in the PhD program in creative art therapies at Drexel University College of Nursing and Health Professions, and also the assistant dean for special research initiatives. She has served on the board of directors and is now the president of the American Art Therapy Association. So, Dr. Kaimal, thank you so much for being with me today.
I'm happy to be here. Thanks for inviting me, Ray.
Yeah, and one of the ways I like to start our interviews is to kind of get a sense of who you are and your motivations uh, as an art therapist. So, what motivated you? What drove you to be an art therapist and to get into this field?
Yeah, I wish I could say that I always knew I wanted to be an art therapist, but that's not quite how this worked out for me. Um, I am and have been a lifelong artist, so a good part of my life, art has been a way for me to cope, to respond to challenges in life. And really sort of use non-verbal forms of expression as a way to connect and communicate and express ourselves. So I came to art therapy by way of first being a designer for several years and finding that there was a part of me that felt unfulfilled. I really wanted to connect with human needs, human motivations. And in the late 90s, I found art therapy existed as a profession. I had recently moved to the US, and it brought together my interest in psychology and the arts. And I went ahead and got a master's in art therapy. I will also, clarify my background is that I grew up in India and Nepal, and I moved to the U.S. in my mid 20s. So I also think about the arts as something that connects all of humanity. Arts have developed across civilizations, across time. So it's something deeply connected to who we are and how we think and how we express ourselves. So I see the value in this work on a global scale. Even though I sort of represent the American Art Therapy Association, I see global impact and global possibilities.
So, in hearing you say that, one thing that comes to mind for me is cultural competency. Because one definition of cultural competency is being able to effectively work with someone from another culture.
Hmm.
And so when people are from, different cultures, it could be quite complicated and challenging to like get each other, right? Understand each other and stuff. So yeah, I kind of like that definition of cultural competency, just being able to effectively work with someone
Hmm.
from another culture. So
Hmm.
it's interesting how you talk about like art really bridges that gap
Hmm.
uh quite a bit, because like we can, I guess we all kind of speak, a lot of us anyway, speak art, right? Like we can express ourselves and stuff through art. Do you experience it that way then, that it kind of bridges a cultural gap in some ways in working with people?
For sure. And I don't want, I wouldn't say like it's the same, right? And this is the sort of paradox and beauty of art forms. On the one hand, it's absolutely unique. The things we are drawn to, our aesthetic preferences, all those are exceptionally unique and shaped by how we grew up and the kinds of things we saw and saw being appreciated. And the kinds of things really speak to us. Those really vary, right? Each of us might have a different favorite artist, different favorite color, different kind of, and I can speak mainly to visual art, but this applies for all art forms. The kinds of things I'm drawn to are very specific and unique to me, and the kinds of things you might be drawn to are very specific and unique to you. And to recognize that in each other is to sort of really recognize that humanity. And in many ways, I have found, and most art therapists will tell you, when we use images, we sort of get to the person and who they are, their personhood, really quickly. You know, in a culture where we speak a lot, sometimes you can hide behind words. And with images, the kind either we create or we view or respond to, our responses to images really tells us quickly who we are. So
Yeah, and I'm sure art therapists are careful not to assume what a particular symbol or color or image means for the,
absolutely, yeah.
yeah, but it like yeah, gives a place for comfortable discussion
Mhm.
about the meaning behind, yeah, what someone has created.
And we would never presume, we always prioritize and want to um, hear and help our patients and clients communicate what each image means to them. So it's not like, a Rorschach test where like
Right.
we interpret in any way. It's really sort of what the image means to you, how we can work with you through this expressive approach to help you reach your goals and help you make choices that bring you fulfillment or relief from symptoms, whatever the goals might be.
Yeah. And not everyone is super familiar with what art therapy is.
Mhm.
So can you share with what is art therapy?
What is art therapy? I
What
explain
is art
what
therapy?
is art therapy? This is. I refer to this as my occupational hazard, in a good way because I love what I do and I see the power of it every time I'm in a session. Um, but it is a small profession right now. There's only a few thousand art therapists worldwide. The American Art Therapy Association has about 4,200 members. There are probably a few thousand more in the US. Art therapy is if I had to define it, is a mental health and human services profession that uses the power of facilitated art making to promote health and well-being and relief from symptoms. It began as a profession primarily, I would say, after the Second World War, where soldiers who were suffering from what was called then shell shock and were not responding to traditional or what was the established, psychoanalytic approach of that time to kind of speak out your traumatic experiences. They were really helped by non-verbal forms of expression, art, music, dance. And similarly, for individuals who are struggling to communicate in typical ways, using words, art therapy was a way to help them kind of connect and communicate and reduce that sense of isolation. So over time, in 1969, in fact, the American Art Therapy Association was established. So it's been around for over 50 years. There are 25 accredited and several more non-accredited, but programs that graduate art therapists. Um, it's a master's level profession. So this is something I try to say to anyone who's willing to listen. So art therapy is not just that, hey, I use a bunch of art materials and that makes me an art therapist. Not at all. So art therapists have to go through a accredited program, 2 years plus of coursework and clinical placements. And you graduate from this MA program, and then you have to do an additional 1,000 hours of supervised clinical work. And then you can get a credential, which is basically ATR, Art Therapist Registered. You can also thereafter do a exam, which is the board certification exam, and then you get the sort of formal credential of ATRBC, and that is the sort of benchmark for clinical practice for us. So it's a profession, it's a mental health profession providing psychotherapy services, which requires extensive training and preparation. So when you work with an art therapist, you're working with a master's level, highly experienced professional.
Yeah. So it sounds like the term art therapist a protected term or
Yes.
regulated term, and who regulates it and who is providing a
Mhm.
certification or credential in art therapy? And like, can anyone say they're an art therapist,
Yeah.
or
No, I
you
hope
know,
not, but yeah.
yeah,
Um,
and if not, why not? Like, who's saying that they can't?
Yeah, so we have a credentialing body. It's called the ATCB, Art Therapy Credentials Board. It is an independent entity from the American Art Therapy Association. It administers the exam, the board certification exam. It reviews your credentials for the ATR. Now, we are working towards having this being a protected title. So it's protected in some states and less so in others. So, in states where it's connected to licensure, this is protected. But we can, so it's different from, say, we are not at the level of, say, social workers or nurses or medical professionals, but we are trying to create awareness about who can use this credential, and we can really challenge someone who calls themselves an art therapist without that degree. Increasingly, as we have a 50 state strategy around making sure this credential is valid and approved for reimbursement, insurance reimbursement and such. And we're not there yet, but at least in 15 states, we have credentialing that is approved and protected. Yes.
Oh, okay. Yeah. And so when someone's looking for help
Mm-hmm.
around mental health,
Mm-hmm.
um, when is it that they would decide to get services from an art therapist versus a different behavioral health professional?
Yeah. So I would say very broadly, firstly, I was just reading the other day, 1 in 4 individuals had mental health needs and reached out for mental health support during the time of the pandemic. So there's also evidence that 1 in 3 individuals will need mental health care in their lifetime. So our therapists are a part of that workforce of mental health providers, and we don't have enough. And I just wanted to sort of put that out there, that that we are mental health providers akin to anyone else. What we I think our strength is that when people often might feel like they're not helped by verbal therapies, or that verbal therapies are not for them, this is a way for them to receive help. So, very often, people who've been through traumatic experiences or have difficulty verbalizing, think about young children or even individuals who otherwise might have been through adversity and trauma and are unable to express themselves in words. Art therapy is a way to communicate and a way to connect. Yeah.
Mhm. Yeah, and I would imagine that some people might hesitate to do art therapy if they don't feel very artistic.
Mm-hmm.
They struggle creating art.
Mm-hmm.
Any thoughts on that?
Oh my God, so many thoughts on that. This is something I hear every time, and I think it's an unfortunate reflection of our society that if you go back in time, thousands of years, the art, music, dance were part of our communities, were part of our tribes, were part of our rituals, and all of us have come from these tribes and histories. So, unfortunately, in the modern era, we've separated out all these things. So and so is an artist, so and so is a dancer, so and so is a musician, so and so is a writer. Oh, but I can't be that because I'm not skilled. And that is so unfortunate. The analogy I think of is, you wouldn't put that pressure on yourself, right? You'll go for a walk. You won't not go for a walk because you're not an Olympic level walker, speed walker. You would not cook because you're not like a 5-star chef. These are things we do for our health and well being. I think of the arts as exactly that, right? Don't put that pressure on yourself. Allow yourself to express yourself in ways that allow for that release, allow for difficult experiences, emotions. allow for that to come out in whatever way feels right to you. So I hear this all the time, and this is what I say in my sessions, both research and or clinical, is there is no right or wrong. Whatever you express is who you are in this moment, and everything you share is valued and respected in this session. That's part of who you are. So, that unconditional welcoming, unconditional positive regard, we call, is a big part of our sessions, and really focusing on the process rather than the end art product, which is where people really put a lot of pressure on themselves. Like, oh, it's not skilled enough. But that's not the point. The point is to use the non-verbal forms of expression that art therapy provides to better understand someone and better understand their needs and better understand where they want to go, and how, as a therapist, we can help facilitate that. That's a long
Yeah.
answer to your question.
No, it's great. And how should someone go about choosing an art therapist? What should they look for? What credentials should they look for?
Mhm.
And then along with that, I assume art therapists specialize with working with particular populations or utilize a particular modality of treatment
Mhm.
within the broad, spectrum of art therapy. Can you kind of explain that a bit?
Mhm. So we have an art therapist locator tool, both with the American Art Therapy Association as well as the Art Therapy Credentials Board. So that'll tell you where you can find an art therapist where you're located. Um, you might also think about, what are things that are important to you? Do you want to meet someone in person, or are you open to telehealth, for example? Are you Do you want to connect with someone of a similar background, be it race, gender, ethnicity, all of that? Those things are things to consider. What Do you have insurance that is potentially reimbursable? So our therapists in some states can be reimbursed, in others not so much. Our therapists also in right now in several states can be credentialed as professional counselors. So do they have that credential? Is that a way for you to get reimbursed, or are you willing to pay out of pocket? How much are you willing to pay? How much copay, or how much direct are you willing to pay? How often do you need to meet? Do you want to have a sort of brief set of sessions? Do you want longer term support? All those are things to think about, and reach out and talk to people, see if they meet your needs. Also, our therapists will list their areas of expertise. So someone might be really proficient in working with veterans, someone else might be really proficient in working with grief and loss, someone else might be really good at working with chronic illnesses, or oncology care. So those are also things to consider should you go to someone who really knows the specific problems you're struggling with.
Yeah, and a lot of other profession types in the behavioral health field utilize art in
Mm-hmm.
therapy
Mm-hmm.
uh, to help people express themselves, or if they're, like you said, if they're having trouble really verbalizing what's going
Mm-hmm.
on internally, using some free association and working with kids and stuff like that. So what's the difference between a behavioral health therapist in a different field? I mean, a different profession type than art therapist. What's the difference between any therapist using art in therapy
Yeah,
versus an art therapist using art?
yeah, yeah. So that's a really great question, and it goes back to what you had asked about: can somebody call themselves an art therapist? And my answer is no. Because we spend a lot of time really understanding the quality of different materials and media. So, very often you might see someone working with art materials with, unless they are proficient themselves in the qualities of different media and the kinds of responses they evoke, both sense of mastery as well as frustration. typically behavioral health therapists do not have that sort of fine-grained understanding of how to connect media and materials with patient and client needs. Furthermore, they might not be proficient in the impact of different media. So things like watercolor can be deeply frustrating because it's a very difficult media to control. Things like clay evoke a lot of responses, and if you are not aware of how different media can kind of activate us, you're kind of doing a disservice to your patients because you're activating things and then not able to support how they feel and how they respond. Our therapists also integrate, it's not like we don't talk, like we spend a lot of time processing and talking. So we have experience really structuring sessions in a way that kind of gets our patients and clients to a point of expression, then processing that, and then helping with closure to um, and sort of insights and lessons that they can take back into their real life, so to speak. Ideally, we want to see translations of what is learned in a session taken out to real life. I mean, nobody owns the art, right? Like anybody can. Plenty of individuals use the arts for self-care, and that's fantastic. But if you want to really delve deep, then you need to work with an art therapist. Yeah.
Yeah, that makes perfect sense. And
Mhm.
where do we find art therapists? Because I know they're like in schools and
Mhm.
hospitals. Where do we find them?
So you can look, as I mentioned, you can look at the art therapist locator tool, which
Mhm.
we have. Several art therapists are also listed by region. So you might simply Google and see who might be art therapists in your region as well.
Yeah. And then the American Art Therapy Association. You're the current president. And
Hmm.
one thing that's really neat about professional associations is they are working hard every day to support clinicians in the field and
Hmm.
the community at large, even
Hmm.
though most people are not even aware of it,
Hmm.
aware of all their efforts. So whether or not an art therapist is a member of the association or not, they're still the association's still working on their behalf.
Hmm.
Um, can you share a little bit about what the American Art Therapy Association is doing, what their mission is, what some of their, what they highlight, successes have been, accomplishments?
Absolutely. So you are right. The association exists to support members, and the American Art Therapy Association exists to support members at all stages of their professional life. And we imagine this to be the individuals who are thinking about becoming an art therapist, those who are in their undergraduate degrees, doing perhaps minors, people in their master's degrees, getting the clinical credentials, to PhD students doing research in this profession, to new professionals, to established professionals, to retired professionals. So we really are trying to support members across their professional trajectory. And we do this in several ways. So we provide a community so members can learn from each other. We have an online platform where people can bring up questions, get responses about their clinical practice or clarifications. So we have a very sort of active member community where people can also sort of form groups around specific interests, school-based art therapy, medical art therapy, working in different settings. So we offer that networking and connection opportunity. We offer mentorship. So you might want to connect with someone who's more established and known in the field, and then they help with your professional trajectory. We do a lot of advocacy and awareness. I spend a lot of time, and several of our board members, executive director, national office, communicating and clarifying what it is that we do, and working towards licensure across the US. So there's legal and sort of political implications, and we work around that. We are deeply committed to so majority of our profession right now is white and female. So we are working really hard to bring in members who represent the range of our clients. So again, when you're asking about how do you look for someone, um, look for an art therapist, we want to really expand our membership and our field to include a range of demographic backgrounds, range of expertise, and expand the field beyond just the dominant demographic. We support sort of independent bodies that accredit the educational programs. So they review and sort of monitor the art therapy programs being offered across the US. We support research to an extent with seed grants and recognizing research excellence and supporting research in the field, because that is, again, an important and perhaps not, we don't have enough. And it's an important element of gaining licensure and gaining credibility and gaining reimbursement, to have solid research showing outcomes. And finally, we work to prepare the next generation of leaders. And this is part of our strategic plan, is to have a pipeline of leadership so the next generation really steps into and takes the profession further. Our mission is to prepare and support our professionals across their professional lifespan. Our vision is to really bring what we know to be the power of the arts to restore, sustain, and promote well-being to anyone and everyone in the world. So first in the US, because we're the American Art Therapists Association, but really sort of communicate this strength we have within us in our creative capacities, and how to tap into it, and how to use that to promote health and well-being.
Yeah. And most professions, like all professions, because of
Mm-hmm.
COVID, had to pivot to providing virtual services.
Mm-hmm.
Um, so I'm wondering what that transition has been like for art therapists, because art therapy, you're using a lot of materials
Mm-hmm.
and you create a space that's really conducive for doing art. Like the
Mm-hmm.
art therapist, part of their job is like creating that space and materials and laying it out and all that kind of stuff. So what's that transition been like, and how are art therapists and their clients experiencing doing art therapy virtually?
Yeah, it's so I will say it was definitely a challenge when COVID started out, because
Mm.
we work best in person. We work best sort of fully engaging our senses and being present with our patients and clients. But that was not the case, right? We were required to be socially distant. And I think it sort of jump started us down a road which is really, really important. And as with everything, telehealth has its advantages and disadvantages, right? So, advantages, you don't have to worry about commuting, you don't have to worry about parking and travel costs, you don't have to sort of worry about time going back and forth. Those are advantages. Several people, people who are more introverted, um, prefer this sort of physical distance, being able to get the supports they need in the comforts of their home, for sure. Um, those were some of the advantages. I think some of the disadvantages are like, questions around privacy, right? So all we see is a screen. We don't know what is going on. And not everyone had that kind of privacy. People had, multiple people living in a home, and maybe you don't have a room to yourself. So, to have a confidential conversation. Those are challenges. It's really hard to see what someone is doing unless you have multiple cameras, right? So we've done things like we've sent art materials, a packet to someone's home, and then they work with it. but still it's sort of disconnected. It's really, sometimes you can't really help and support in the actual making process. There's an element of frustration to that. We don't have adequately advanced tools to really do this digitally. So there's an element of learning around both for the patient and for the therapist around how to manipulate digital tools. So I think those are some of, and as a result, there's been innovation, and we spoke a little bit about the new AI tools, and there's kind of been an explosion of digital options, which is super exciting. So yeah, I think there's several advantages, especially for people who might find it hard to commute, people who are in rural locations, people who have challenges with, physically being able to come to a session for a variety of reasons, health or distance. All those were helped by telehealth, but it's still a process. I think we are learning how to do it.
Right. Yeah, that makes sense. So hopefully more tools and
Hmm.
people's comfort level with technology will be as helpful.
Hmm.
Because yeah, I imagine, being able to see what the person's working on in their space and see them well, right? Having the
Hmm.
two cameras set up, a, wide view camera and camera like this, but the average person doesn't know how to set that up or have the technology and
Hmm.
so forth. Yeah, and then I imagine the virtual tools for doing art, where you can do art on your screen and get all these different objects and stuff like that,
Hmm.
is not the same as real tactile
Hmm.
art.
Hmm.
Then you mentioned you mentioned like the AI,
Hmm.
where you can put in terms and ideas, and AI will create something, and then you can interact with that and so forth. But yeah, and that's a tool, a really neat tool, but also um, you might want that real tactile
Yeah.
and yeah, being in the same space. So it sounds like it has, like you mentioned, it has its benefits,
Hmm.
and then there's the benefits of being in the same room with an art therapist who's providing the space and the materials and so forth. Yeah.
And this goes back to our biological roots as well, right? So if you think about it, our brains are, we are like the same people we were 30,000 years ago. And the way we felt safe, we like to think we are.
Yeah. Evolution, I think, takes a long time, right?
It takes a long time. Our
Yeah.
basic emotions, our responses, our needs are
Yeah.
really not that different from
Right.
thousands of years ago.
Right.
So, how did we feel safe? How did we feel a sense of community and belonging? Was to be in physical proximity. Now, I don't want to minimize. I think a lot of people do, and justifiably so, feel connected. We have ways to be connected online and social media, all of that. I don't want to minimize that. But at a bodily level, that physical connection and presence is deeply connected to how our sort of inner brain recognizes safety and belonging and trust. So, right
Yeah.
now, I only have your face and your
Right.
voice to go
Yeah.
by. Okay? But there's so much else that helps us trust somebody and feel heard. It's
Hmm.
how you sit, how you sort of angle towards someone.
Yeah.
What is the room like? What kind of materials are offered? How do we talk about it? All those things have a level of potency and value that are slightly different. And
Yeah.
again, it could work the other way too. Like you might not feel
Right.
comfortable with someone in person, and
That's right.
yeah. So there's
Yep.
a combination of factors
That's
to
why we've individualized care, right?
exactly. And
Individualized care, because yeah,
I don't want to minimize the value of telehealth. I think for a lot of individuals, that's
yeah,
tremendously valuable. So yeah, there's a
yeah,
place
yeah. I
for
think it's
all.
I stress that a lot in our courses and stuff, that it really it's on the individual level. Some
Hmm.
people might feel more embodied
Yeah.
at home virtually versus in your office, whereas some people might feel more embodied in your office than at home, right? I mean, yeah. So it's and then it might differ from week to week.
Exactly.
So,
Exactly. Exactly.
yeah, it's right. Well, this has been super helpful. Thank you for all the work that you're doing, because being the president of the association, I assume it's a voluntarily position.
Yeah.
And I assume it takes a whole lot of time and effort. Uh, that's why we have terms, right? How long is your term?
2 years.
2 years. All
I'm
right.
almost at the midpoint, and I will
Yeah, you
say,
got to
like, our
train the next person, hopefully.
yes, yes, that's a big part of both our mission as well as my personal goals, is to really develop the next. That's the responsibility of any leader, is to prepare the next generation, prepare, have a succession plan, and we have all of that. So
Excellent. Yeah. Thank you so much. Really appreciate it.
great, great to talk with you, Ray.